Good afternoon, everyone. Thank you for coming out again today. Can I once again pass on the thoughts of all West Australians to the people of Queensland and New South Wales affected by the terrible flooding. It's remarkable that there is still more rain to come. We will continue to offer any assistance we can. That is the right thing to do. Can I also offer my thoughts to the Prime Minister following his positive COVID test? I wish him a speedy recovery, as I do Ben Morton, the member for Tangney, who is also now positive. I'm also writing to the Prime Minister to offer any support the Commonwealth needs from the state of Western Australia in relation to the Ukraine crisis. Now, to a COVID update. Can I confirm to 8 p.m. last night, Western Australia recorded a total of 1,770 new cases. Of these, there are 1,766 local cases, 4 are travel-related cases. This is off the back of 14,545 PCR tests conducted yesterday across public and private providers. Today's cases include 732 self-reported positive rapid antigen tests. It's encouraging to see the rise in testing numbers, especially when you consider that we don't know how many rats are taken that are negative in the community. WA now has 6,979 total active cases. There are 16 people in hospital. This includes 9 new COVID patients compared to the 16 that were reported yesterday. So in other words, a range of people left hospital. We wish all these people all the best. And in good news, we have no COVID patients in intensive care. It's important for everyone to remember that we are expecting hospitalisations to climb rapidly in coming weeks. The experience in the eastern states is that hospital admissions lag about 2 to 3 weeks behind case numbers. So while the current low numbers are very, very encouraging, it would be wishful thinking to assume these kinds of numbers will continue for much longer. But we know that we are prepared, we are very prepared for rising hospitalisations. And a lot of that is thanks to West Australians who have rolled up for WA and continue to roll up for their third dose of vaccine. We now sit at 64.6% for our third dose rate for West Australians aged 16 and over. This is a great achievement by everyone, but we want to see that continue to climb. It's actually an Australian leading achievement. With the WA border opening in full tomorrow, we know that our case numbers will start to climb even further, which means the chances of you becoming infected with Omicron will get higher each and every day. So please, if it has been 3 months since your second dose, please go and book your third dose in now at our state-run clinics, your GP or your local pharmacy. The medical evidence is clear. The third dose will provide you with the best protection against Omicron and severe illness. Now, tomorrow, along with the WA hard border opening, the revised Level 2 PHSMs come into effect. As you know, thanks to our world-leading vaccination rate, we did not have to go as far as we thought we would. We managed to mostly avoid the 4 square metre rule. That being said, the Level 2 restrictions will still have an undeniable impact on some businesses. That's why we want to make sure they are in place, the public health social measures, for the shortest amount of time possible. Restrictions on businesses are not something we are used to in Western Australia. Compared to the rest of the country, business has had to spend very little of the last 2 years in lockdown or operating under restrictions. No one enjoys putting in place public health social measures. I don't enjoy putting in place public health social measures. But with the peak of this outbreak fast approaching, it's more important than ever that we follow the health advice. Hopefully, less than a month of public health measures or high public health measures during the most dangerous time for the state is the right call to make. But I know it doesn't make it easy for a number of people and businesses. And for that, I'm sorry. Our careful and cautious approach has served WA well, saving many jobs and many lives. And it means we have the financial capacity to support our WA businesses through the Omicron wave before us, just like we have previously. Whether that's initiatives like the Rent Relief Scheme, providing grants of up to $3,000 to eligible small business tenants, the Performing Arts, Theatres and Cinemas Assistance Program, providing payments of up to $50,000 to provide cash flow assistance to a range of larger indoor entertainment venues that are particularly affected by capacity constraints, and the $10 million extension and expansion of the Getting the Show Back on the Road program to cover up to 75% of lost ticket sales where a state government mandate has resulted in an event being cancelled. The $3 million event supplier support program and an additional $9 million to attract major events. As flagged on Monday, today I can announce the next round of our business support. Our $72 million Level 2 COVID-19 Business Assistance Package. This is the 5th business support package we've made available since December. What's different about this round of financial assistance is it is available to all business types and sizes in the event they are dramatically impacted by COVID. Firstly, the $66.8 million Small Business Hardship Program. Tier grants to businesses that experience at least a 50% reduction in turnover across any 4-week period since January 1 compared to the same period in the previous year. That may have been over the coming 4 weeks. That period may have already happened. We want to ensure that small and medium businesses that employ Western Australians have the support they need over the coming month. Sole traders will be eligible for a grant of $3,000. Micro businesses with 1 to 5 employees will be eligible for a grant of $7,500. Small businesses with 6 to 19 employees will be eligible for a grant of $20,000. And medium-sized businesses with 20 or more employees and an annual payroll of up to $4 million will be eligible for a grant of $50,000. It won't cover everything, but together with existing support, like grants, rent relief, and waiving government fees, it will help make a difference during this difficult period. This support will help the micro, small and medium-sized businesses that need it most get through what will likely be the toughest month of the pandemic. It will help those businesses that employ others keep West Australians in a job. This package will provide important support to the hospitality, arts and events industries. In addition, large hospitality businesses with payrolls of between $4 million and $20 million will receive a 3-month payroll tax waiver in the event they also experience a 50% drop in turnover over a 4-week period since January 1, 2022 compared to the same period last year. This applies to larger cafes and restaurants, clubs, pubs, taverns and bars. We estimate just over 100 businesses will be eligible to apply for this specific support. Again, I know for many larger businesses, payroll tax relief for 3 months might not be enough to cover the impact of the next 4 weeks, but I hope it still makes a difference. Also, while a range of support has already been announced for the arts and events industries, we also acknowledge the disruption caused to professional sporting fixtures. The $2.1 million COVID-19 Commercial Sporting Franchises Support Program will provide a $35,000 rebate per game for venue hire costs until 30 June. This will provide some assistance to teams like Perth Glory, Perth Wildcats, Perth Lynx and the Western Force. This program also includes the waiver of public transport charges for games held in March and a 50% concession on public transport costs for games in April. We know that for many of our summer sport teams, the combination of WA border controls and now capacity limits does have an impact on how they run their businesses. I want to thank those WA teams, many who are now arriving back into Western Australia, for their understanding and efforts in difficult circumstances while continuing to go about their work in a professional manner. My government is committed to safeguarding businesses, local jobs and the economy from the full brunt of COVID-19. That is why we have now committed more than $420 million in support since December and a total of $1.7 billion since the pandemic directly to business as part of our overall $10 billion response to COVID-19. That includes the $67 million Level 1 COVID-19 Business Assistance Package announced the other week and $77 million Safe Transition Industry Support Package just before that. I'm sure these businesses would all rather be trading with no restrictions rather than receiving support. But the reality is, everything in this pandemic is a choice, and there are consequences for each of these choices. I wish it wasn't the case, but that's the reality of what we face. We've come so far in the pandemic. As a state, we've done so well. I know everyone is tired and ready for the pandemic to be over, so am I. But while we are facing our biggest challenge to date, take heart in the fact we have avoided the worst of the pandemic over the past 2 years. The economic devastation, the serious illness, and the large loss of life experienced elsewhere. Take heart in the fact that we are ready for what's to come, that we pivoted our strategy quickly from Delta to Omicron, that we have a highly vaccinated population, we have testing systems and isolation systems in place, and that our hospitals are ready. Take heart in the fact we're moving forward. Tomorrow we take a big step forward as our border controls come down. Families can reunite without unduly risking the health of the state. It's going to be good to see. WA has done so well throughout this pandemic, and West Australians are ready for the next phase. Do you have any questions?
Premier, when will this compensation reach businesses?
Well, it's available from tomorrow. So all people need to do, all businesses need to do is apply. There's systems in place for them to apply. And if they meet the criteria, obviously we'll process payments as quickly as possible.
Are the grants only available if, to event organisers if an event is cancelled? Can they still get some or all of the grant if it's able to be rescheduled later?
That's something we're considering. So they're getting the show back on the road package, and we've done a few versions of that, by the way, over the course of the last 2 years. It normally is about cancellation of events, but we know there is an issue with postponement and there are some costs there, so we're currently reconsidering that at this point in time.
If people are currently in travel-related quarantine for 7 days, will they be allowed to get out at 12:01 and beyond straight away, or do they have to complete their 7 days quarantine?
They'll be free to leave.
Even if they're being told otherwise by police?
Once the border comes down tomorrow at 12:01, they're free to leave.
Will hospitalisations, when they're reported, be separated into people in hospital for COVID as opposed to people in hospital for other issues with COVID?
We follow the national guidelines there. This has been raised at National Cabinet. I've discussed this personally with the Prime Minister, how it works. And other states, as you know, have a great deal more experience with COVID than we do. You know, they've had hundreds of thousands of cases, whereas we have not. So, and they've had many, many thousands of people in hospital. They basically count everyone. And that's the national rule. We follow the national guideline.
So should West Australians assume around half of the hospitalisations are people that have that are there with COVID rather than before COVID?
It moves around. It moves around. Sometimes people, it's more than half. Sometimes it might be half. I'm not sure exactly, but I'll just make one point to you. Sometimes it's difficult to determine if a person is in hospital with or for COVID because they have a range of illnesses. And did COVID mean that they went into hospital because of COVID itself or because of the other illnesses? So sometimes it's very difficult to determine, and it's a very sensitive issue. Now, we haven't been through it in the way that they have over in the other states, but you know, apparently it's very sensitive as to how you judge these things, and particularly when people die, how you describe how they died. So obviously that's something that's a bit outside of our experience, but we just follow the national guidelines.
Given that, and given 16 people in hospital with COVID at the moment, none in ICU, why is a red alert necessary for the hospital system?
Well, because we follow the health advice, and the professionals who run the hospitals make these judgment calls. But it's based upon the fact that there is a lag in hospitalisations. Now, at this point in time, Western Australia is doing incredibly well. 16 people in hospital. Other states, New South Wales today has 1,072 people COVID-related in hospital, Victoria 264, Queensland 312. Western Australia we have 16. Other states yesterday, Queensland had 24 people pass away, Victoria 28, New South Wales 5. And that's an ongoing situation in those states. So we obviously had no one. Our situation is very different. We're doing extremely well, but there is a lag in hospitalisations. So we expect the hospitalisation rate will grow over coming weeks, and that's why our hospitals need to be prepared.
But given that lag, why couldn't Red Alert wait until 2 weeks? It means there'll be a lot of surgery cancellations, visitor restrictions for 2 weeks without those extra hospitalisations.
No. The unwinding of the reduced number of Category 2 and Category 3 elective surgeries doesn't start till 14 March. Obviously, if we don't get the hospitalisation rate, we can continue to book people at that point in time, but there's no program to do that until the 14th of March, and larger private hospitals not till the 21st of March, so that's still best part of 2 weeks away for public hospitals. In terms of the other precautions, it's increased use of RAT tests for patients, increased use of PPE across all areas in the hospitals, the extended use of telehealth for outpatient services, voluntary RATs 3 times a week for healthcare workers who work with high-risk patients. They're all just precautionary measures that are being put in place.
And no visitors except for essential visitors or those who are exempt.
Yeah, we announced that the other day. That's designed to reduce the spread of Omicron in the hospitals, which I think most people would understand.
So with people getting their elective surgeries cancelled from the 14th and 21st of March, a lot of them are saying that we've spoken to that it's desperately needed and they're devastated. Have you got anything to say to them?
Look, the program is designed to ensure we don't book people from that point in time, so that we don't then have to cancel people's surgeries. So that's what we're trying to do, not book and cancel people. But if we need to, we can schedule appointments if we don't have the spread we expect of the virus and the hospitalisation rates from the virus.
Will you consider a surge allowance for hospital workers, such as what's in place in Victoria, $60 per shift, or up to $60 per shift?
I haven't considered that, sorry.
Can you clarify, when the border opens at 12:01 a.m, will unvaccinated people interstate still be locked out, or can they come in and quarantine?
No, unvaccinated people from interstate won't be permitted.
And that applies to West Australians who are unvaccinated and leave the state and try to re-enter as well?
Correct.
The 16 in hospital, can you provide a breakdown of their vaccination status?
I'm sorry, I don't have that detail.
Why not?
Well, they move around. So there's 9 new people from yesterday to today. So getting all those details on a daily basis is not easy because the number of people change. So some people arrive, they might spend a day in hospital and they're gone, or they might spend 2 days in hospital and they're gone. By the time we get the details, they're already out. So it's not so easy to nail down those details on a daily basis. We will try to get that information, but it moves so quickly that it's by the time you get it, it's often inaccurate.
Will you
We've
publish
been
it
told
into the
before-
future?
We've been told by health that it's for privacy reasons, but you have
Well,
provided vaccination status before.
There is some arguments around that because the numbers are so low as well. There's concern that you might be able to identify people. So those sorts of things are sort of clinical decisions.
But
What
you
about-
provided the vaccination status of the most recent death related to COVID,
Yeah.
and there are concerns from his family that that was apparently wrong.
I provided what health provided me at that point in time and announced exactly what health provided, that we clarified a number of times before we provided that information. But the information around people who are in hospital and their vax status, as I said, moves so quickly that by the time I give you information, it may be wildly out of date.
So it's not being hidden because, you know,
I mean, honestly, in terms of transparency, I come out here and answer all your questions every day, provide you reams of information, every bit of information we possibly can. So we're not hiding information. This is all just about the fact that information changes and moves virtually on an hourly basis, and providing information that is inaccurate is not something I want to do.
What about businesses who are, who formed or created in the last 12 months? Are they also eligible for the compensation as well?
I would have thought so.
Just very quickly, so a lot of our viewers that are watching this now, they really want to ask you why there are no homeschooling options or remote learning options for parents who doesn't want to bring their kids to school, because they felt that schools are a super spreader event at the moment. That's what they think.
Schools do provide materials where required, particularly if there are kids or students that can't go because they are close contacts or they are positive. But we do actually want children to go to school. So we're actually encouraging children to go to school. Other states have gone for weeks or months or virtually years without kids going to school. We haven't been through that experience, and we want face-to-face learning to continue. So I realise mask wearing for children in year 3 and above is uncomfortable, and some people don't like it. But it's a measure we're putting in place to prevent the spread of the virus from children to their parents and grandchildren and grandparents, and all of the issues that entails, and also to ensure that kids themselves are protected.
And just on that, the Education Minister says kids won't be sent home from school if they don't comply, but Police Commissioners also said officers won't be patrolling and shutting down community sports if there's spectators other than parents there. So are some of these level 2 restrictions really just strong recommendations, and is the angst they're causing outdoing the benefit if they're not enforced?
Look, we've had at various points in time over the last 2 years, we've had to put in place rules, and overwhelmingly, West Australians have done the right thing and complied. So there's a lot of, I suppose, people just wanting to do the right thing, and community pressure for other people to do the right thing in conjunction with the other members of the community. So look, we can't put a police officer on every corner or in every cafe or in every schoolroom, but we do put in place rules that people overwhelmingly do comply with.
Do you know how many G2G passes have been approved at this point in time?
Yes, there's 27,814 approved G2G passes to travel here from March 3. As of tomorrow, we're expecting 5,000 arrivals into Western Australia. The advice I have is 22 domestic flights, 5 international flights, and so that's a fair number of people. Having said that, when we announced the earlier changes to the rules, in particular with the compassionate exemption with 7 days quarantine, we actually had about 30,000 people come in, so a lot of people still took advantage of that opportunity.
And how quickly do you expect tourism to ramp back up to pre-COVID sort of levels?
Tourism's been going a lot stronger over the course of the last 2 years than pre-COVID. So around Western Australia, because West Australians couldn't go overseas and at various points in time couldn't go interstate, the tourism industry around the state and hospitality was the strongest on record at various points in time. So that's been the reality. We predicted in last year's budget, or perhaps mid-year review, that there would be a decline in both retail and also in tourism once we open the borders, because a lot of West Australians will go elsewhere, and the spend that they would ordinarily do here will go elsewhere, unfortunately. But that's the reality. When you open the border and you do that, you'll have higher numbers of people travelling elsewhere, and West Australians are stronger travellers perhaps than other people around the world, and so therefore there's a net outflow of income. But just to give you some information, the latest national accounts figures came out today, or late yesterday. State final demand in Western Australia, which is our domestic economy, has increased by 7.2% since 2019. Over the course of the last year, state final demand, the state's domestic economy, grew by 6.6%, which was easily the strongest in Australia, and particularly built on household consumption. So that's West Australians spending within Western Australia, because we didn't have an economy in lockdown. We had the most free and open society in Australia, and we had the strongest spending capacity, and people were kept in jobs whilst elsewhere they weren't.
Sorry, I'll rephrase my question. How quickly do you expect interstate travellers and international travellers to Western Australia to bounce back to pre-COVID levels, given, as you say, a lot of West Australians will leave the state and will need to replace that tourism income somehow?
I can't predict that, but I do know we've got major investment in airline attraction and also tourism campaigns and also international campaigns. So because we've gone through COVID with the strongest economy and the strongest finances, we have better capacity to invest in those things than other states and other countries.
Do you think it will take some time, though, for WA's reputation with interstate and international travellers to return to what it was?
No. Our reputation will be as the safest jurisdiction in the world that handled COVID the best in the world.
Anthony Albanese's on, I think, the first flight into Perth this evening. How much time will you be spending helping him campaign?
I think I'm catching up with him for a meeting tomorrow.
Just on the assistance package, do event organisers have access to that, or just the Get the Show Back on the Road package? Will they be able to get the business grants as well?
No, I think the events, it's around the getting the show back. Sorry, I think the events organisers. Let me go through it. So the small business hardship program is largely it's this. So it's $3,000 grant to sole traders who can show a 50% reduction in income, and that's in addition to the package we announced last week. $7,500 for micro businesses, 1 to 5 employees. $20,000 grant to small businesses, 6 to 19 employees, and $50,000 those with 20 or more employees and a payroll up to $4 million. So it all depends upon their income over the course of the 4-week period up till now, or at least up till the end of March, and how it compares with last year, whether they are eligible for that. The Getting the Show Back on the Road program continues, I'm advised, till at least June.
You've emphasised that it's just 4 weeks, hopefully, for the level 2 restrictions to minimise the impact on business. But the entertainment and events industry is saying that they really have felt the impact for 2 years because of the border closures and artists not being able to come in. Do you acknowledge that that industry in particular has been decimated by the border?
It's no doubt impacted them dramatically, as it has having an international border for the rest of the country, because obviously the rest of the country couldn't do it. At various points in time, Queensland, New South Wales, Victoria, Tasmania, South Australia, Northern Territory and the ACT all had borders as well. So it's something that has impacted every state, because each state had these policies in place over the course of the last 2 years. But the good thing is we've had various programs to support the events industry. The programs are still in existence.
Do you have any detail on how much is being applied for under the compensation for level 1 restrictions that was announced, and how much, if any, has been provided under that?
I don't have that to hand, I'm sorry.
Is the Fremantle Oval Derby this weekend capped to 150? It's outdoors, no stadium seating.
So the advice I have from the police is they've examined that and they've assessed it to have 50% capacity.
Why?
It's a ticketed event. There are QR codes. There are some seating arrangements which are forward-facing, so they've assessed it as a 50% capacity event. Thank you.
Thank you.